you can lower the cost. You take the travel out, you take the consumables out, you reduce the time, significantly reduce the time. Our research shows anywhere between 40 to 200% reduction in the time to acquire the knowledge and the skills that you might need.
Is the Apple Vision Pro the future of surgical training? Hello and welcome to TechFirst. My name is John Koetsier. As nasty as it might be, you need to train surgeons somehow, and often that's been cutting open human bodies, dead bodies. Traditionally, that's how it's been done. Sometimes models. Increasingly, that's being done with VR. Fundamental VR offers VR training for surgeons, as do competitors like Oculus VR, Precision OS. Most of them use the Oculus platform, which is fairly cheap and accessible, been around for a while. Some might use the Vario line of high-end VR systems. What about Apple Vision Pro? To chat, we have the CEO of Fundamental VR, Richard Vincent. Welcome, Richard.
John, great to be here. Thank you.
Super pumped to have you. Thank you for joining from a hotel room on your trip in Houston, I believe you are. Let's
right.
start, before we talk about Apple Vision Pro, let's start here. How much cheaper is it to train a surgeon using VR versus the other possibilities?
Yeah, great question. There's a couple of ways of looking at this, really. So, cost comes down to consumables, and then it also comes down to time. And the big factor really is time. There's irrespective of whether you're talking about an early stage training experience, so resident trying to acquire first knowledge, or whether you're talking about a long tenured surgeon who is trying to learn a new technique, there's a learning curve. And it can be anywhere between 10 or 15 cases up to in some scenarios, 100 cases. And so it's about speed of repetition. How fast can you get around that? Traditional training techniques have involved cadaveric, so human specimens, other types of specimens, and they generally involve a lot of logistics, moving people around, getting to different locations, setting up. They become very slow and very expensive. So where VR and immersive and spatial training comes in really is it allows you to go round those repetitions much, much faster. And as a result, you can lower the cost. You take the travel out, you take the consumables out, you reduce the time, significantly reduce the time. Our research shows anywhere between 40 to 200% reduction in the time to acquire the knowledge and the skills that you might need.
And so that reduction in time, I assume that has an equivalent reduction in cost. And I guess the second part of that question is, do you get to the same level, or is it just different? Is it better? Is it equivalent? Your thoughts?
Yeah. So I have a phrase I call pre-human competence. So let's not touch a human being before you've got real competence. We're not there today. So we're, to your question, we are an augmentation of existing techniques. We sit alongside them. We allow those techniques and those training environments to perhaps work harder because of the preparation that happens in immersive technology. And in some cases where traditional techniques just don't work, and I'll talk about that in a second in the subject of gene therapy, we have actually become the standard. So we've replaced those old techniques because, quite frankly, they're just not fit for purpose when it comes to that particular surgical skill. So it's a bit of both. But I think overall, our vision is all about getting to something we call pre-human competence, which is don't practice on me, practice on a simulated version of me, and then come into the OR and perform on me.
That's super interesting. And I can see that making a ton of sense that, hey, you can do it 25 times, you can do it 500 times in VR. You can get pretty good there. And then maybe you do it sort of with a cadaver once or something like that. I don't know. But you to get a real feel or a model. But that makes a lot of sense to me. Talk about the platforms you use. I assume you're using Oculus. I saw that on your website. Do you use any others? What do you use?
Yeah, great question. We are we're completely hardware agnostic and deliberately so. So when it comes to platforms, HTC, the Microsoft mixed reality platform, of course, the Meta Oculus platform, and the new Apple platform are all ones that we operate within. Um, we've deliberately stayed and will stay agnostic because this stuff's moving so quickly. Our users and our customers don't want to worry about which one's going to be the latest and greatest. They want those training experiences, those simulations to work irrespective of what's rising and falling. So whether it's a headset, and we talked about those, or whether it's a haptic device that delivers the sense of touch, feel, resistance, all of those elements, the hardware for us is about finding the best fit based on the capabilities that are there right now. But our software stays universal and plugs and plays into those different areas.
How on earth do you do that? I don't assume there's an abstraction layer for different VR systems. Do you develop native binaries for each platform, or is there something that I'm not aware of that translates software for the Oculus to software for Microsoft mixed reality headset or something like that?
There's a lot of crossover, actually. There's a lot of crossover. Less so with the native um, Apple platform than we've seen with others. But again, game engines like Unity, like Unreal, they offer common standards that actually then allow you to go to a particular destination headset. There's always a bit of tweaking, there's always a bit of adjusting to do, and that creates an overhead that we have to bear. But we think it's worth it because it allows you to say, well, today, Meta 3 could be the device that most people are excited about and have access to. Tomorrow, it could be the Apple Vision Pro. 3 years' time, who knows?
Exactly. Good segue. Apple Vision Pro. Let's talk about it. When you saw that come, maybe you've tested already. I'm sure someone in your company has. What are your thoughts with regard to its usability for surgical training, other types of training?
Yeah, we've been working with it extensively for the last few months, and very close with the development team over at Apple Vision Pro. Um, it's fantastic. Is the headline? I think there's a lot of really exciting things to love about it. So let me try and remember and break down some of those things. So let's start with the simple things. The Apple ecosystem. We all know it. Well, most of us know it, and it translates so beautifully into the Vision Pro that it becomes a very familiar space to start in, which is always a lovely place. The gesture control system that they put in place is phenomenal. Exactly. Yeah. Well, you don't even have to lift your hands up. That's the point.
Yes.
So,
Just
John, I'm
look.
sure you probably used HoloLens back in the day, and we'd all be reaching out and pinching. Well, none of that now.
Failing.
It's and failing. None of that. The gesture recognition on this device is phenomenal. So if you put that along with the user interface, and your eyes are your mouse, so you're navigating with your eyes and pinching with your fingers, it becomes a very simple, intuitive thing to use. Then you've got the firepower of that device. So you're talking about compute power on your headset that we've never seen the likes of before. It's the equivalent of a MacBook Pro Plus attached to the front of the headset. And you can means that companies like mine can do a lot with that. So we can increase the fidelity, the frame rates, the interaction level significantly. And we can really, really bring that thing to life. And then you've got optics, which again have gone up another level. So with the compute power and the optics, you suddenly have hyperreal, which is fantastic. We've always, we've always worked on the basis of create to the highest standard, and then we've had to bring it down to the headset that we're targeting. For the first time ever, we're now at the point where we're not really having to bring that down very much at all. It's really quite phenomenal. And then I guess the final point from our standpoint, because as a business, we're really, really focused on both physical interaction as well as the virtualization piece. So we've been able to bring haptics onto the Vision Pro in a way that give you both a sense of presence in hyper real fidelity plus the interaction that allows us for our use case to create a physical interaction with that virtual patient.
Well, that's a surprise, because I was thinking, hey, Apple Vision Pro, sort of like, with iPhone, Steve Jobs says your finger, you don't need a stylus, your body is the interface type thing. Apple Vision Pro, you look at something, that's your interface, you tap anywhere within the field of vision down by your side, and it recognizes all that stuff. And you can attach game controllers to it. There's some challenges with that, but you can attach game controllers to them, play games. How are you getting haptics? What are you doing for that?
So we over the last 8 years, we've been building what we call our haptic intelligence engine, which is designed to work with multiple different types of hardware to deliver that hyper real physical interaction. So we've managed to port it across into the Vision Pro. I wouldn't say we've got it at production level yet. It's still fairly early stage, but we've made the jump across, which is a significant one for us.
Now, let's talk about what haptics you're talking about, because I'm Apple Vision Pro. I'm wearing this thing on my head. I don't necessarily have controllers in my hands. So when I'm thinking haptics and I'm thinking VR and I'm thinking training, I'm thinking there's a thing in my hand and I'm doing something. Maybe it's aircraft maintenance and I'm screwing something and I feel some resistance or some buzz or some, maybe it's surgical training as you're doing, and I feel a little bit of resistance somehow, some magic of the motors buzzing in the little controller in my hand. What haptics are you talking about?
Yeah. So we're talking about grounded kinesthetic haptics. So force feedback. So resistance against your hand as you interact with something. So our use case and and it's on the App Store now. So we have a system on the App Store that you can see. You won't be able to interact with the physical part of it because it is our device. But what you're holding is a grounded haptic device. It's actually a device called a Happy Inverse One. Um, it interacts with our system on the Vision Pro. So in our scenario, you're in an interventional cath lab. You're placing a needle into a patient under ultrasound, just so it's ultrasound guided. You feel the patient's skin. You can interact with it using the needle. And then the key point is about placement of that needle into the patient and getting it in the right place. So
That's
it's
super impressive. You have your own
it,
hardware.
third-party hardware. We don't make,
Okay.
we're pure software. Yeah.
Okay, excellent. So Apple Vision Pro, I mean, one of the things obviously that is stunning, sort of like the high-end Vario headsets, is just the visual quality. Just incredible, impressive, amazing, near reality, right? Retina scale, as Apple talks about. It's got Pro in the name, but that has some cost implications as well. Does device cost matter? I mean, most people can pick up an Oculus, for 250 bucks, 300 bucks, something like that, get a Pro for more. But if you go Apple Vision Pro, you're talking significant change, $3,500.
You are. And, that's going to have an impact on how it lands for sure. In our use case, we're very much focused on the enterprise market. We are focused on a fairly high-end use when it comes to medical grade training. And compared to the alternative costs, it actually isn't really relevant. You have, as you say, $3,500 at the base level. That's really not an issue at all.
I was kind of thinking about that. I'm in Vancouver, Canada, so I understand the Canadian healthcare system, somewhat the US, because I travel to the US quite frequently. But with the costs that are in the US healthcare system and training costs for surgeons, I mean, it seems like a kind of a rounding error. But I thought I'd check on that.
Yeah.
I wanted to hit something else. As we chatted about before we started recording, I didn't think remote surgery would come into this conversation. But you mentioned that you're working there, you're doing some things there. Let's talk about remote surgery a little bit. I mean, that's happening more and more as rural areas are losing doctors, right? And especially high-end specialists and surgeons who are congregating in urban centers, let's say, or more desirable places, coastal places, who knows? And we have these sort of healthcare deserts. And so remote surgery or even remote medicine in general is significantly growing. After I think the first time it happened was 2001, something like that. Talk about that and how what you're doing and maybe what Apple Vision Pro is doing can help in that.
Sure. Um, so the need to collaborate within a surgical team is obviously key. And what we can do with our platform is to allow that collaboration to happen, irrespective of where somebody is based. So we have we call it collaboration VR. You can see where the name came from. Um, it allows us to remote people into a single virtual operating room and to work together as a team on the setup, on the flow, on the procedure itself, to really go through that rehearsal process of working together without physically traveling. Now, we're not in, and I'm sorry if I misled you earlier, we're not in remote surgery, but we are in remote training of surgery. And robotics is a key part of that. So, there isn't an area of surgery or any part of medicine in procedural terms that isn't being impacted by robotics right now. And the need to, again, remotely collaborate around that to bring experts into a space where you can learn, understand, and practice using that device. That's really where our platform comes in. So we're able to create that type of collapsing of physical space using that system.
That's very interesting because if you're a doctor or surgeon or something like that, you have to maintain your skills. You have to upgrade all the time. You have to get additional credits, right, for learning new procedures as well as just maintaining your status essentially. So that's a way of doing that without, flying to New York.
Right, exactly that. And if you look at innovation within the industry, um, the single biggest inhibitor on the rollout of any procedure or any drug, any innovation, ultimately is about the few surgeons, doctors, innovators, and their willingness to travel, because often the training and the knowledge transfer is a 1-to-1, 1-to-10 environment. If you're lucky, at a symposium, maybe 1-to-100, but really it's down to a 1-to-1. So if I've innovated and created a great new technique, but it requires me to travel the world for the next 10 years to get that into every location, that's a bit of a chore. Unless of course you love flying. But what we can do is digitize that capability. So we can take John, the expert surgeon in robotics, and how you do it, and we can digitize it and we can put it anywhere. So even if you don't arrive in real time in our virtual space, we can have a version of you with your telemetry, your eye movement, your head movement, all working within that space to teach you, understand what you're doing, guide you all the way through. So it can be really powerful.
The mind kind of boggles because that allows you to set up a course library that allows you to obviously there's going to be all kinds of processes and procedures. This is the medical industry. There's tons of regulations and everything like that, but as people have new ideas about how to do something, they can share it very, very quickly and very, very widespread. Super interesting. Cool. Anything else that we've missed? Anything else that maybe what you does Apple Vision Pro unlock anything that you couldn't do before?
Yeah, it does. It does. It offers us, I think, a real window into the next generation of immersive technology and what we can do with it. Simplifying the interaction, simplifying the kinesthetic haptic interaction, simplifying the hardware around that. All of those things, it allows us to really move the dial on all of those going forward. So that for us is really exciting. That's why we've been delighted to work with them on it over the last couple of months, and we'll continue over the next few months as it really starts to put its feet down. I think the other thing though is there is within the medical field there is a really high desire to use Apple product.
Mm,
And that shouldn't be underestimated, right? The pull effect, I think, that we will see with this. The number of surgeons I have who are saying to me, I've got one already. What can I do with it? It's phenomenal. So,
yep.
then you need a push and a pull. And I think that's happening with this product for sure. So I think we're going to see some real traction happen quite quickly.
I can see that. I can expense it and then I can use it at home.
Right.
Excellent. Well, Richard, thank you so much for this time. I do appreciate it.
John, great to talk to you. Thank you.